right now we are broadcasting live on the National Health Federation Facebook page, and I'm also downloading this as well, and I will edit after and upload to our YouTube channel, and then also just have a file in case that channel gets deplatformed or what have you. Okay, we have just 20 participants so far. Good afternoon, Jack. Good to see you.
Good afternoon, everyone. It's wonderful. Dr. Benz, hi.
Hello, Jack.
Broman, hi. I saw Greg. Hi, Greg.
All right,
Jack.
This is probably the most important event taking place in America in the last 2 years.
Jack, Alex, Dr. Benz and I were considering inviting you to set the context in about a minute or so after I welcome folks before turning over to Dr. Benz.
Oh,
or do you want to speak later?
No, whatever. That'd be fine. I mean, it'd be an honor, actually.
Okay. So whenever you're ready, Alex, what time is it?
All right, it's 12:04 here on the East Coast. And like I said, we are live right now on Facebook. And once this is finished, we're going to put this on the YouTube channel. And if need be, it could be other places. And this is our first step in this whole series. And I would say it's been greatly anticipated. So I'm really excited that we're all here together. And thank you, each of you, for being very generous with your time today. And like Jack mentioned, you know, this may be one of the most important meetings happening in the world right now.
Indeed, Alex, and welcome everyone. We started this project 2 months ago with our well-attended Zoom regarding the state of integrated care in health plans, which make up 1/7 of the US economy. And what Dr. Benz proposes around upgrading, usually the entry point of healthcare, does affect the world. And Jack will kind of internationalize that context. But the idea is, if we can enable this paradigm shift that's already occurring with group plans, with individual plans, with healthcare outside the formal payment structure, that's going to help our other goals to upgrade what people think of healthcare in general. So welcome, folks. I hope we have a good experience with Dr. Benz, who, as we know from the write-up about today's event, has a vast experience with governments and Fortune 500 companies, iron out their internal conflicts. He's a fantastic facilitator. To his credit, we have a clean river, the Danube River, in the eastern portion of Europe. He can maybe mention that later on. He's helped other governments, stop the conflicts among different bureaucratic heads and people's turf battles. So he's good at finding that common ground to get us to that next goal. In this case, a better paradigm of healthcare. So that I'll introduce Jack Kracian, our NHF fundraiser and marketer extraordinaire, and he is really upped our game in introducing us to influencers worldwide who really want to know more how we can work this project through this organization, NHF, which has been around since the 1950s. So, Jack, take it away.
Thank you very much, Charles. Ladies and gentlemen, honestly speaking, I'm about the most average guy you ever met, outside of the fact that I had a chance to travel in the world and establish, communication tools and via FM radio that literally changed culture and enhanced manufacturing and income and expendable income ratios in third world countries and succeeding in these environments. But when you think about Mr. Benz and Dr. Benz and what he's done in relationship to way beyond cleaning up a river, I remember in 1970, when the Cuyahoga River was catching fire about 3 times a year, and we initiated the environmental movement that literally changed the world. Okay, so here's Benz actually cleaning up the Danube, but more important than that, he's brought he's brought many countries, especially Eastern European countries. I'm Romanian, and we're very active ending communism in Romania in 1989. quite active in that regard. Okay. The function of ending tyranny is one of the reasons we're here, but a myriad of categories. And Dr. Benz is one of the few educators. And on top of this, a Ph.D. in nutrition, who has this extraordinary background in taking enormously complex nation state problems like converting a communist country to, say, a parliamentary democracy, and to bring all of the players together who have no education whatsoever about parliamentary anything. Usually I find communists to be belligerent, uneducated, until their countries evolve. And at the end of the day, that evolution is based on the children who they spawned that got to go to American schools, English schools, German schools, and what have you. And, they changed their country. So we're going through all that again now in the world, and we're going to succeed. Everything's going to get back to normal, but we need guidance to get us there. And Dr. Benz possesses, I promise you, every single tool we need to succeed in neutralizing myriad dilemmas and delivering the future of medicine, enhancing the human condition, returning health to humanity and our environment through the only institution on earth designed to produce those end results, and that's the National Health Federation. There's just nothing else like it on earth. We have to talk about it. We have to bring it to people's attention. We have to be very selective about how we discuss the enemy, because we have to endear that enemy to the intellectual processes of rising above into enhancing the human condition rather than delivering man's inhumanity to man. End of story. Dr. Benz, God bless you for joining with us that day. That was a day, that morning before that meeting, I was in prayer for about 2.5 hours. Like, how am I going to have a future with NHF unless we have a way to follow through on all the geniuses in this room tonight? Okay.
I'm praying that we have enough time.
You got it.
All right. Thank you, Jack.
You're welcome.
I really appreciate it. I hope you didn't oversell me, because that's one of the worst things you can do. But now
the oversell you, Doc.
now the bar is raised pretty high. Anyway,
I've got the research.
Thanks to you.
Listen, everybody, I actually researched him, and what he did in Eastern Europe brought every one of those, a large number of countries, into the United Nations. Into the European market, the EU, okay. Which, that triggered literally maintaining the integrities of their evolving democracies. This is a marriage made in heaven. So
mine was a small role. Mine was a small role. So thanks very much. Let me get started. And I'd like to thank everybody for being here. As you can see, the title is Shifting the Healthcare Paradigm Towards Prevention. And I would mention to you quickly that we tried to do this through a competitive approach in the last 30 or 40 years. That didn't work. We tried to do it in compromising, and that didn't work. So we're going to try a new approach today. It's called collaboration. And in the collaboration model, we used guided discussions. And so this is the first of a series of guided discussions that we're going to have on this topic. And I think one of the things that you need to know is it's about the process. We have all the content in the world, but we have no process to follow to get this job done. And so it's kind of like a song. A song has words and a song has music. The words we have aplenty. The music we have none. And so the music is the process of what we're going to follow to try to get this done. And another sort of story that goes along with this is you can give a person a fish and they can eat for a day. You can teach them how to fish and they can eat for the rest of their life. And one of the stories that I didn't put up on my website is about a European community that after the downfall of the Soviet Union, their unemployment rate was 25%. I spent 1.5 days with the mayor and her team and some community leaders and taught them the tools that you're going to learn. And in 3 years, they got their unemployment rate down to 5%. 25% to 5%. It was a miracle in my mind, but they did it. All I did was give them the tools and walk away, and they did it. They did the rest of it on their own. So I think we have to start by having some agreement on what the facts are. And so I'm going to try to walk you through a history of what the facts are that we're up against. And I think this is important for everybody to have a common groundwork for where we're going, a common background. And that's what we're going to try to do today. So please bear with me. I hope there's room for questions at the end. I'll go as quickly as I can. It's going to be recorded. The video will be there. If I go too quick, you'll be able to go back and take a look at it. So first, let's take a look at conventional medicine. They've been struggling for a long time. The US spends twice as much as other countries to achieve some of the worst health outcomes in the world. Over 95% of health dollars are spent for treatment, but only 5% is spent on prevention. And 80% of disease is preventable. 80% of chronic disease is preventable. Over $100 billion is spent annually on angioplasty that's resulted in, so the fifth point here is prescription drugs, according to some sources, cause 700,000 emergency room visits and over 100,000 deaths every year. On another study, they found that the Institute of Medicine reported that there were over 40,000 avoidable hospital deaths every year. And Gary Null, who has a book out, Death by Medicine, reported that the total number of avoidable deaths annually is 783,000. One of the important good sides of this story, if it is a good side, is that Dr. David Eddy did a study on allopathic medicine and found that there was really good science to only support 20 to 25% of what they do. And the Journal for Clinical Evidence reports that only 11% of conventional medicine treatments are beneficial. So this is kind of damning information. The worst of this comes in what's happening right now. 97% of people trying to lose weight fail. 90% of people trying to quit smoking fail. 83% of people who try to quit alcohol fail. 90% of type 2 diabetes is preventable and reversible in most cases. 90% of breast cancer is preventable, and other cancers between 70 and 90% as well. 70% of adults are currently overweight or obese. Diabetes will increase by 500% in the next 20 years. Health costs per person rose to $13,100 in 2018. It's probably up to $14,000 or $15,000 now. The U.S. will spend 100% of its GNP on healthcare by the year 2065. That's according to Economist magazine. And what we know is if it even gets close to 30%, we're going to be in big trouble, and it's already around 20%. That was thanks to some information from my friend Ruth Lininger. This is the study that was published in 2006, where Dr. David Eddy did this review of prescription medications and surgery and found there was only good science for about 20 to 25% of what they do. This was on the cover of Business Week magazine. And I want to tell you that from my recollection, there wasn't one editorial response to this. And I think that's what they wanted to do. They didn't want to prolong the argument. They just wanted to bury this and get it out of the way. And so the public didn't respond. The politicians didn't respond. The media certainly did not respond. And so this should have been one of the messages that we took away, that this was a big problem if we didn't get any response to this kind of reporting. So another kind of startling book was written by Dr. Lundberg, the editor of JAMA for 17 years. And he saw firsthand that conventional medicine avoided accountability and followed the dollar. And so he wrote this book, Severed Trust: Why American Medicine Hasn't Been Fixed. And that's just one example. I can give you probably 20 or 30 books that have been written on a similar topic about medicine not doing what it's supposed to do. This was a book by Dr. Abramson, Overdosed America, examined the use of prescription medication and found that a majority of drugs have poor research behind them, and they're often not necessary, and sometimes they do more harm than good. So this is another one of those books that falls into that category of damning evidence that's not been paid attention to. This was a very telling book by my friend and colleague, William Falloon, editor of Life Extension magazine. And in my understanding is that the FDA went after him 20 different times. And on 20 different occasions, he went to court and beat them with good science. So the courts aren't standing up for this once they get confronted with it. And so he wrote a book, FDA, Failure, Deception, and Abuse. And I think this is one of the resources that many of you may be seeking to put into your libraries now. I hope that's the case anyway. This is the book that I referred to earlier. Gary Null, who's a very popular natural medicine doctor in New York City and has his own kind of radio show and lots of followers. And we'll certainly want to make him aware of what we're doing so that he can reach out to his followers and let them know what's happening. This was one of the great stories in functional medicine, natural medicine that we need to be aware of. And I'm sure you're all aware of it, but it was written like 20 or 30 years ago. And Dean Ornish wrote this book, Reversing Heart Disease, and it took the insurance industry 20 to 25 years before they were able to agree. And the only organization that started that was Blue Cross and Blue Shield in Pennsylvania, and they started to cover it. And how they covered it was, and I can tell you by this example, my neighbor has a blockage in 4 of her main arteries of 98%. The hospital wouldn't operate, but they said, you know, you need to go on the Dean Ornish diet. So it's not giving as an option to everybody with heart disease. It's giving an option to the ones that they don't want to work with. And so that's, I think, a big serious problem. There's lots of books on diabetes, how to prevent it, how to treat it, how to reverse it. This is one by Broadhurst. There's another one out there by Julian Whitaker, who claims to have treated 25,000 people over the last 20 or 30 years and has a 90% success rate reversing their type 2 diabetes. This is another book about arthritis called The Arthritis Cure. Again, these are similar stories. Arthritis is a disease of inflammation and mostly caused by eating diets that are acidic with too much meat and dairy and sugar and processed foods. So if you go to eating a vegetarian diet with a small amount of really good protein, most people will get their arthritis either resolved or at least reduced. If you get some of the proven supplements along with it, most people get their arthritis resolved fairly quickly, within 3 or 4 months. This was a New York Times best-selling book by Dr. Joan Larson, Depression-Free Naturally. And again, she has a clinic in Minnesota, or she did have. I think she's either retired or no longer with us. But at that time, 20, 30 years ago, she had the leading edge protocol for treating depression. She also has a book out, 7 Weeks to Sobriety, which used her similar nutritional protocols to actually get a 74% remission cessation rate for alcoholics, and not with just a 5-year cessation rate, with a 15 to 20-year cessation rate. So again, another doctor that knows what she's doing. Osteoporosis remedy, again, eating greens, not dairy, less meat, less sugar, less processed foods, is able to get most of these osteoporosis patients resolved as well. And same thing with reversing asthma. Asthma can be a very debilitating thing. It can be some genetic markers in there that can influence it. But you need to know that poor air in this country is causing the average person to lose 2 years of life. In India, it's 9 years of life. In big cities in India, they're losing the average of 9 years of life due to air pollution. So this is a serious problem that needs to be addressed. Cancer, there's no bigger problem facing us, but here are a couple of books to look at and consider. How to Starve Cancer by Jay McClellan, survivor now 25 years, and had cancer 4 or 5 times, and finally decided to do some research and found a solution that found out that sugar is not the only thing that cancer loves to eat. It also likes to eat protein sometimes. It also likes to eat fat sometimes. And so you have to know what kind of cancer you have before you can say, automatically, well, cancer should be, you should stop sugar every time you have cancer. So this book is magical in that regard. It really gives guided evidence for how people should eat in order to reverse their cancer. And this is another book by a colleague of mine, Dr. Michael Murray, How to Prevent and Treat Cancer with Natural Medicine. And Dr. Murray has a long history of treating chronic disease with nutrition and supplements and other natural treatments. And one of the things that he has said through the years is one of the greatest myths about natural medicine is that they are not scientific. The fact of the matter is that most common illnesses, there's greater support in the medical literature for a natural approach than there is for drugs and surgery. And this was actually, he said this before the David Eddy article came out. So now he would say probably it's even more dynamic than he reported at that time. And this is one of the things I think that it's a crime to not know and have this information. But look at the organizations that have got onto the vitamin D3 bandwagon. Science Daily reported 125,000 people that were taking 44,000 international units of vitamin D were able to reduce their pancreatic cancer risk by 86%. The Karolinska Institute in Sweden found that vitamin D reduces Hodgkin's lymphoma by 46%. High levels of vitamin D increase survival rates of colon cancer by 48%. That was just the Dana-Farber Institute in 2008. Why isn't this being reported in the media? Why isn't this being used by medicine everywhere? The Mayo Clinic, high levels of vitamin D increase survival rates of lymphoma by 50%. And finally, lung cancer survival increased by 47% with high levels of vitamin D. This is from the Harvard report of cancer causes and control. So there's no excuse for this information not to be shared widely. In a recent patient experience that I had with a patient in Chicago, I asked them to ask their doctors whether nutrition was a factor in treating the gentleman's cancer. And they said, no, you can eat anything you want. And then he brought out the book from Jane McClellan and said, what about this book, How to Starve Cancer? And the chief oncologist said, oh yeah, I've heard about that book. I haven't read it, but I've heard about it. Well, my dear, you should have read it, and everyone on your team should have read it, but you didn't. And that's where the problem comes in. So in 2009, the Senate decided to hold a hearing, the Senate Health Committee, and they brought some experts in, Mehmet Oz, Andrew Weil, Dean Ornish, and Mark Hyman. And Mark Hyman, at the end of this 4 hours of testimony, said, you will never solve the current healthcare crisis if you just continue to try to do the wrong things better. And so that's the treadmill that they've been on for the last 30 or 40 years. You will never solve the current healthcare crisis if you just continue to try to do the wrong things better. So Mark Hyman then, in a really serendipity story, was on a plane and happened to sit down next to the CEO of the Cleveland Clinic. They had 7 hours to talk. At the end of the 7 hours, the Cleveland Clinic CEO said, what you're saying, and what I tend to see that I agree with you on, is that we're doing almost everything wrong. And Mark Hyman said, yeah, that's probably right. But that was in 2011 or 2012. And so the CEO said, well, let's get this started. And Dr. Hyman said, well, you're not going to want this because you're a $6 billion organization. You're going to lose a lot of patients. You're going to lose a lot of your doctors. This is not going to bode well for you. So they went ahead, did some more research, and in the end, they decided they would move forward with a Chinese medicine division and a functional medicine division with protocols and lots of research, looking at allopathic medicine and the corresponding protocols from functional medicine. And so what he found out was that functional medicine really was working. And so one of the parting things that he said before he retired was functional medicine is the medicine of the future. So going back to Bill Falloon and his organization, Disease Prevention and Treatment, this book comes out every other year or so. And of course, he has a monthly magazine as well. But this book has 130 evidence-based protocols to combat diseases of aging, which basically means chronic illnesses. This is a book that Dr. Murray put out with Dr. Bizzorno, and it's now sold about 5 million copies. It's 1,000 pages of evidence-based protocols on how to treat chronic illness. Dr. Bizzorno, as you may or may not know, is the founder of Bastyr University, now the largest and most reputable natural medicine school in the country, in my estimation. Lots of grants from NIH, getting lots of things established as being evidence-based for chronic illness. He served on the Integrative Medicine Advisory Board with 2 presidents, one a Republican and one a Democrat. So it doesn't matter in his case whether they're Democrat or Republican. They wanted to know what his advice was. And what he tells me, now that I've got to know him and work with him, is that he gave a lot of advice, but a lot of it really wasn't listened to. But he has developed an AI platform. And I think this is really good because he took this book and converted it into an electronic template. And he did a study of about 10,000 people over a 5-year period and found they were able to reduce their healthcare costs by 12 to 15% every year for 5 years in a row. This is a book by another doctor that I've begun working with, Dr. Thomas Lewis, and his website is called healthrevivalpartners.com. And he talks about how bacteria and pathogens and inflammation and other biomarkers are important to be measured in order to know what the real true state of the chronic illness is. The health risk assessment that he uses has 150 questions, and it gives you a score of A, B, C, D, or F, which is failing. He has 55 biomarkers in his test that are combined with the HRR results, and that is measured on the basis of your temperature. Your temperature should be 98.6. If that's what your temperature is, then you did good in combining all that information. The higher your temperature gets, the worse your chronic illness is, or your potential for chronic illness. So this gets to the root cause of illness and provides strategies for improvement. This is probably one of the most sophisticated doctors in the country in terms of dealing with chronic illness. And this is the artificial intelligence platform that I mentioned before. There were 20,000 people involved in the overall trial. The results for participation were 85% for those 20,000. But for the 10% in just one company, they did this 5-year evaluation, and that's where they got the 12 to 15% reduction of healthcare costs every year. I don't think there's any other wellness program that has even come close to producing that kind of evidence. Don Baker is a small business person in South Carolina that I've been working with, and I met him at a Vistage presentation. Many of you may know that Vistage is the largest CEO network in the world, over 20,000 CEOs. And he begins to bring in a wellness program with articles and workshops and in-house consultations with individual employees. And I do that in South Carolina, participating with the employees to learn more about how their body works and how they can either prevent disease or go with their doctor to help reverse the disease that they have. He sees my little book called Health in Your Pocket. He buys about 500 copies, which gets about 120 for his employees. And the other he gives away for anybody that comes into his operation. He sponsors an annual conference with over 200 swimming pool executives. And he asked me to participate, and I gave the talk on swimming pools and the danger of chlorine gas, and how chlorine gas reduces the level of zinc in your body. Reducing the level of zinc in your body on a regular basis can actually cause cancer. And so when they found out about that, I think a lot of them made a lot of changes. He also developed an employee ownership program called ESOP. And with that program, he got employees to buy in, not only to the wellness program, but to higher productivity and a lot of other benefits. And so he's now thinking about joining another organization with 1,000 companies and 8 million employees and over 24 million employee members overall. Is Don Baker interested in shifting the paradigm? I think he is. I think there's no doubt about that. Some examples of best practices that I think I just want to touch base with you on. Wisconsin School Initiative. This is the Appleton School District. they had a whole school of high school level students that were dedicated to kids with problems, emotional problems. They worked with a natural food store, natural ovens, to put in a breakfast and lunch program. And after 3 to 6 months, I think it was about 6 months, I did an interview with the principal of the school, and I said, "So how's it going?" She said, "I can tell you, for the first time in the history of this school, we have no incidences, just by changing the nutrition of these students." In Maryland, the public schools there started to implement a food literacy program for all students. The students learn about nutrition culturally and geographically. There's a lady from the School of Medicine and Nutrition at Cornell University set that up. And she worked with another organization called Physicians Committee for Responsible Medicine, where they have a Golden Carrot Award, where you can go and have your school lunch program evaluated. And if you pass this test, you get a Golden Carrot Award. If you don't, you get recommendations on how you can improve your nutritional program so that it can meet the standards of the Golden Carrot Award. And I just want to tell you that most schools are not up to these standards. All right, they're using the USDA funding and foods, which are not always the healthiest, unfortunately. And so this is really important to know, because these are the best practices in this area. And some of the other best practices I want to report on: Philadelphia mayor puts his city on a diet. This is the New York Times, 2001. Rosencare gets 2 Diamond Awards and a Silver Award from the World Health Congress in Washington, D.C. He has a self-funded healthcare program in his Rosen hotels in-house, and he has 7,000 employees, and he was able to save $340,000 by using this program, and he won this award in 2018. I think this is a best practice. CVS stopped selling cigarettes. CVS loses $2 billion, according to a Forbes magazine study, as a result of this decision. But the CEO said, the sale of tobacco products is inconsistent with our purpose. This was in 2017. And then doctors in California are now prescribing food as medicine. This was done actually as a legislative initiative in Sacramento, and they got this legislation passed, and it's being successful. This was published in the Huffington Post in 2018. And now they're going further. Why food prescriptions are the best medicine for chronic disease. This was from Healthline, March 20th, 2019. And then finally, as part of this COVID experience, I searched and searched to find some place, some hospital, some medical school that were using a natural protocol to treat COVID. And here it is. East Virginia Medical School uses integrative medicine for COVID: vitamin D, vitamin C, zinc, vitamin B complex, ivermectin, and melatonin. So these are just some of the scientific references. I'm not going to go every one. You have them in your video, but you can see here diverticulitis, modified citrus pectin for cancer and heart disease, resolving inflammation with pro-resolving mediators, hyperthyroidism, how to boost underactive thyroid naturally, reversal of chronic decline, a novel therapeutic program in Aging Magazine. This was an Alzheimer's protocol developed by Dale Bredesen. And then there's the Dr. Ornish reversing heart disease from JAMA. Even the big magazines, the medical magazines, use this, but they're not reading them, and they're definitely not putting them into practice. There's no incentives for them to do that. And this one is diabetes can be reversed with a plant-based diet. Again, this is evidence that this stuff has worked in a clinical trial. And here are some other ones: vitamin C for allergies, modified citrus pectin for cancer and prostate disease, vitamin D to prevent cancer, magnesium for depression, coenzyme Q10. In this study, which is classic, all of the patients were on dialysis, and they put people on 180 milligrams of coenzyme Q10 for 3 months, and 50% of them were able to get off their dialysis machines. And the reason the other 50% were able to get off, I'll show you in 1 minute. Here's another peer-reviewed protocol by me, reviewed by Natural Medicine News. 50 doctors from around the world reviewed the protocol and said, yes, absolutely can work. And then I did another article on John Barson's website, Total Health Magazine. And this was to improve the outcomes that are being used to measure healthcare. Did you know that the Baldrige Award only is given to organizations and hospitals that have processes that are beneficial and improved? They have no outcomes at all. I called them, I said, why don't you have outcomes? Isn't that sort of the bottom line? Oh, we haven't gotten around to that, was the answer. Well, you don't know how to do it, is probably the real answer. And this is the example of the 6 stages of cellular decline that I use. And in this one, I can explain that cells go through these 6 stages. They become stressed first, then they become weakened, and then they become challenged, then they become dysfunctional, then they become mutated, and then they become diseased. In the study that I mentioned on dialysis, there were a lot of people who still were on dialysis because 10 or 20% of them were either stressed or weakened or challenged, dysfunctional, mutated, or diseased. But if there were enough of them in the first 3 categories, then they could get off their dialysis. But when I go to medical conferences and I say to doctors, so why weren't the others able to get off their dialysis? It takes them about a minute or so. And all of a sudden, you can see a light go on above one's head. And he goes, oh, I know. Too many of them had gotten into the mutated or disease state. And I said, oh, good for you. That's the right answer. And so we know that even people who have kidney disease to the point where they need dialysis are able to get off of it with just 1 supplement. And we know that there are 3 others that they could use that would even be better for them. So has all of this that we've talked about worked? I mean, we've written letters to congressmen. We tried that. We've submitted articles to the mainstream media. We tried that. We've written books. You've seen all the books that have written. There's hundreds and hundreds of books. We've tried that. We defend the legislation. Every other year they come up with legislation to do away with supplements. We tried that, but you know what? That threat is now increasing. We've tried to change the medical school curriculum. Very few medical schools are actually changing their curriculum to integrative medicine, where natural medicine is given equal status as long as it's evidence-based. So promote self-care. Well, more and more people are doing that on their own, on the internet, but that's not the right way to do it. There's a right way and a wrong way to do it. And they don't know that they're always getting the best sources. So this is not really a credible way to do it, but there has been mixed success with people taking their health into their own hands when they research it properly and work with their doctor. Insurance coverage for natural medicine, very, very little. And so the insurance codes just aren't written yet for this. And that's the problem. That's one of the big problems. Have we tried a collaborative, priority setting, fully focused, systematic problem-solving approach? No, we haven't tried that yet. That's what we're going to say today we want to try. And so this problem-solving process has 6 steps to it. First, you name the problem in 50 words or less. Then you name the goal, again, 50 words or less. Then you do a root cause analysis. And this is important because people want to jump to the solution right away. You don't get good solutions until you get to the root cause of the problem. In everything that I've done, in every jurisdiction and company in the world, we must do root cause analysis accurately and thoroughly. And then you can go to stage 4, brainstorm the solutions. No stone left unturned. No rules. There's no rules for this. You can say any idea that you want. In the 5th level of this problem-solving process, we do what we call an effort and impact grid. We try to find out, sometimes the term is used low-hanging fruit, but basically, what's the low effort? What's the high impact? Those are the ones we want to put in a sequence, and we want to then put them into a plan. So this is how number 6 comes about. We make a basic plan, and then if everything goes well, we have probably 5 or 6 or 7 categories of solutions that need to be delved into a lot more seriously and deeply. that's where we're hoping that the teams that come out of this exercise will self-identify that they want to be on this particular team, they want to go through this process for this particular problem, and they want to get after it with the tools that we're going to use. And it won't be just this tool. There's other tools. But here, let me mention the problem statement that I came up with and shared with a few people at the Federation. The problem is the majority of healthcare industry is focused on treating the symptoms of sick people for profit with mostly scientifically weak strategies. This system is unsustainable and will soon lead to less healthy population, which will bankrupt individuals, organizations, and eventually the entire country. The goal is to accelerate movement towards the use of illness prevention with evidence-based medicine to provide safer, more effective, and less costly healthcare. Additionally, individuals and organizations need to take more responsibility for efforts to prevent and reverse chronic illness with proven tools and strategies supported by informed and motivated government and healthcare decision makers. And why is this going to work? Well, I think basically it works because you have to have good participation with a large cross-section of people who are knowledgeable enough about this topic to really contribute. It captures ideas quickly with a few words and not long, verbose discussions. It has long discussions are discouraged actually because they just take too much time, and we don't have a lot of time. We need to use our time very, very efficiently. The root cause analysis avoids premature solutions and conclusions. Brainstorming is also quick and comprehensive and creative. The prioritizing that's done is quick and accurate and time-saving. And the sequencing is logical and time-saving and strategic. The action planning is quick and inspiring. And the follow-through is motivating. And allows groups to get involved and reduce costs and get realistic actions and get measures for how those actions are going to be determined to be successful. So all these tools can have a benefit if they're used correctly. So what are some of the other processes that we're going to use? These are some names of some of the ones that I've developed over the years. Readiness evaluation surveys, best practice research and utilization guidelines, sequential questions and consensus building, force field analysis and benefit risk analysis, the 4-column change chart analysis, the journey map visioning exercise, the criteria-driven priority setting, shuttle diplomacy decision-making, and ranked versus percentage impact analysis. So those are just some of the different tools that we'll be introducing to the groups and getting them to master them so that they can go forward and be able to be successful in their team efforts. This magazine article was written 6 years ago now, the beginning of the end of the war on medicine. I wrote this in response to the decision by the Cleveland Clinic to embrace functional medicine. And I thought, oh my God, this could be the beginning of the end of the war. People are going to fall in line now because look, we've got a really big clinic that's bought into this. I'm sorry to say they didn't fall in on this. So that's the end of my presentation. I thank you for your time and your patience today. And I think if there's any questions, Alex, can you help guide us through this?
Well, thank you very much, Dr. Benz. That was very comprehensive, yet we do still have some time. So I see Charlie's hand is up. I see Jack as well. Charlie, would you like to unmute yourself?
Sure, thanks. And I think our president, Scott Tibbs, is here as well. We might invite him to give a response on that presentation, and I'll defer to Jack at this point on next steps.
Sounds good.
So you may have a double-blind placebo-controlled study.
Oh, Scott, maybe.
Yeah, no, I'm off mute now. Can you hear me?
Yes.
Okay, good. All right. Well, that was a nice presentation, Dr. Benz, and I appreciate the time and effort you put into it. The one comment that was being discussed here, I don't know if you want to say it. Okay. But is that when you compare a new treatment to a placebo, you're comparing it to nothing. You really need to compare it to the existing traditional treatment that's there. So if you have a replacement for high blood pressure medication, then, for example, then you compare the new treatment to that, not to a placebo. And that's one of the failings of the current system, is that you're comparing to placebos, and that's how all these new drugs flood the market. But that's not really the correct way, at least, to do it. You need to see if this will replace a current treatment, and you do that by testing it against the current treatment, not against a placebo. So that's point number one. Point number two would be that really, I like this approach. It's a good approach, and it's something we need to do. But so many people, until we address the fear factor, so many people are coerced, or out of just sheer fear, they're frightened back into the conventional orthodox medical system. We see this time and time again. And even, I won't name names, but even a current friend of NHF's who is a good doctor in the Midwest, he was diagnosed with cancer, and what does he do? He knows better. I mean, he's preached this himself to use alternative methods, but he's fallen back on chemotherapy. So the fear factor really drives a lot of the industry.
Yeah. Yes, I agree with you.
To a lot of the patient. 2 comments for the moment, and those are items that need to be addressed at some point.
You're absolutely right on both counts, Scott, and that's what the Cleveland Clinic is actually doing. When they develop a natural protocol, they compare it to the existing ones, the best of the existing ones. And as far as fear goes, that will be addressed. I'm sure that when people get into their work groups, they're going to mention this. I know I will mention it, and I know others will too. And yes, you're absolutely right. And it's not only fear; it's fear of their license, as well as the fear of not using the treatment.
Yeah, so, that's true. Yeah, absolutely.
So we will absolutely, because when we do these analyses and those comes up, that's when we have to get our hats on and say, how do we address this fear? And that will be addressed in almost every one of these teams that we work with.
When we discussed within our foundation, the Future of Medicine Foundation, as young as it is, we've got some brilliant people associated with it, and the focus is global, and the dynamic is education that needs to be delivered to those that are fearful. So our focus became clinical trials of nutrition-based medicine, and our leader here, Scott, just hit the home run. You can't do it against a placebo. You really have to get into a true clinical trial, multi-centers, multi-ICUs, multinational, and then you can achieve the miracle of impacting our mainstream medias that initiate the educational process, literally. And when we get consumers talking and we get C-suite guys writing checks, they listen. And I lived that experience with the environmental movement in 1970. We established that out of Cleveland. So history is going to repeat itself. And here it is again. So the idea of clinical trials in the nutrition-based medicine field is the key to truthfully winning in the media arenas. It's not the biggest tool for winning. It's just the first tool to get the road paved to winning.
Well, this has to be one of those things that's addressed in the root cause analysis. So you have to ask the question, what is the cause of that fear? And in the case of the doctor in Scott's case, maybe he wasn't sure about the natural approach that he had researched or knew about. And maybe because his life was on the line, when push came to shove, he went with the thing that had been maybe used and worked for the last 10 or 15 years. I don't really know what the reason was in that case, but I know that we have to find out what the root cause of that fear is. And so if it's because there's too strong a feeling out there that doctors are gods and they have all the answers, then we have to address that, and we have to address it in a way that's positive and not going the negative route and trying to denigrate doctors. Just say, look, there's problems. They need to be solved. We want to help you to solve these problems. And so I think the process is pretty good at finding out what the root cause is of this fear, whether it's patient fear or doctor fear. And then there's ways that we can, I hope there'll be ways that we can rectify those problems. So I think they're all good statements, but we need to get to the root cause of those problems.
My life experience is cut and dry in this regard. It's media. It's media. It's media.
Well, yes and no, but why is it media? It's the root cause of the media is money. And the root cause of the money is the medical, the
war zone is always the flow of cash.
Pharma. So follow the money. And so that's where we get to the root cause of it. And then why can't that be addressed? I mean, that's one of those things where it could be addressed, and maybe what part of the root cause is government continues to allow that to happen. So there's all kinds of implicating factors in there, but we have to dig deeper and always find out what we can do about the root cause of the problem, not what we can do about the symptom of the problem.
We have 3 raised hands over here. Jay, that's the question.
Perfect timing. You know, it's just remarkable that we just segued into what's the root cause of the fear. Well, it's media, well, it's government, well, it's money. I don't know, guys. I mean, I've been in this field since I'm a teenager. The money, the money, the money, the money, the money. I mean, and it's not just the money, it's our entire economic, I refer to this whole economic structure we're in as a barbaric level of socioeconomic cultural evolution that we have to grow beyond. We're still in an economic, you know, a caveman level where if it's not patentable, if you can't have a monopoly, if you can't, you know, hoard the money and get rich on it, it has no basis for collaboration, for funding studies, for education, for lobbying, for advertising on the media to have influence there. You know, this exists in the energy sector. This exists in every sector, you know, military industrial complex, be that as it may, but we're focused on the health sector. And the idea that projecting things out, 100% of GDP can be going to health care, which of course means those that have monopolized how to profit on treating disease are getting all the money from the public. Think of the power that gives, and it's been this way for a long time. And until we find a way to address that, we're not really going to be able to bring out the kind of change we want. And I don't know how to address it, but I think focusing on how to address it has to be a key priority in everything we're trying to do here. And if nothing else, at a minimum, in making the case for everything that Dr. Benz is brilliantly showing us and pointing out here and, you know, leading us to, it seems to me we have to emphasize, I mean, you know, a slide that shows the money being made and the percentage of GDP. I mean, already, as far as I know, for a long time now, healthcare costs are the #1 cause of personal bankruptcy in the United States.
Yes.
We have to find a way to change the idea that if you can get rich on it, you can fund the studies and have your monopoly, and nothing natural lends itself to that. How do we address that? How do we educate people about that?
Well, you know, that is also part of the problem. You have to be able to educate people, because until the people change, the politicians won't change. It's like Gandhi said, where are my people? I need to go and lead them. And so you have to find a receptive group first. And so sometimes you don't find it nationally. And we mentioned this earlier, that sometimes you have to find it in a city like Philadelphia that decided to have a weight loss program. or San Francisco did the same thing. So sometimes you have to find it in states and in cities and in organizations. And so wherever we can find a friendly and a beneficial partner, and we can work with them to find a solution that works, the more solutions we build up, the more we get closer to the tipping point that Glad shall work to. The tipping point is where we need to get to. And so that's what we're trying to do with this. And so the effort impact grid will tell us whether the fear is too big and we need to go somewhere else. So these tools all kind of self-regulate where we go, what we study, and where we put our efforts and our money.
All right, we have 3 more hand raised. I know Ruth has been very patient. Would you like to ask your question? And we have Greg and Scott.
So I had more of a comment. From what I've read, it's actually, this problem is actually perhaps even more urgent than we might realize. That there is some precedent that when any sector of the economy approaches and hits 20% of the GDP, that it triggers this tipping point for rapid change to address essentially this stressor on our economy. And I think most small businesses, large business CEOs, I think they, even individuals, we understand the crippling amount of money we are spending on healthcare, and how it's really not serving us. And I think these next few years are going to be absolutely critical, actually. And I'm so happy that we have a group of people addressing this issue here, because it's really in everybody's best interest. The big pharma, the insurance industry, there's doctors are good natured, but the hospital systems, the entire system is deeply corrupt, and it's the system's fault. It's been set up wrong, and it needs to be adjusted, and in a way to avoid a massive economic collapse and crisis that will affect everybody, even those with big pockets. And so I think it is a time for collaboration and working together. And I would say, in response to data, oh my gosh, there is so much data. If you look on PubMed, we are just overwhelmed with data on how effective many of these alternative natural lifestyle remedies, approaches are. It's not for a lack of data. It's following the money. It was, Mark Hyman said to the CEO of Cleveland Clinic, Harry, Cosgrove, he's, basically said, if you bring in functional medicine into the Cleveland Clinic, you'll like bankrupt the hospital. Hospitals are driven, they're reimbursed by disease treatment. Insurers make their money by having sick populations. The system is corrupt, and we need to move. Like one CEO of a hospital I used to work for said, we need to move the cat food, and then the system will change. And it certainly isn't going to change overnight. I would suggest maybe as a result of some of these problem solvings and solutions we come up with for the root cause analyses, brainstorming, maybe there are ways that we can kind of layer onto the existing system that's ineffective, ways to adjust gradually over time, so that we can kind of preemptively address this crisis that's really looming, I would say, very large, and especially triggered by COVID, the spending packages, the chronic disease crisis layered on long COVID is just really a perfect storm. So I'm so grateful to everybody who's attended. I'm so grateful to, the National Health Federation here to do this, and to Charles Benz and everybody. This is an enormously important problem. So.
Thank you, Ruth.
Yeah, thank you. So we have Vice President of NHF, Greg, next, and then President Scott, and then the executive director of NHF Canada, Beatrice Penn.
Well, aloha, everybody. Dr. Benz, it was great hearing your presentation. And of course, for me, it's very frustrating because we've been facing this dilemma now, certainly since the late 60s and early 70s. It's frustrating in so much as, you get a token, you get the Cleveland Clinic to set up a program. And of course, they're kind of an unusual group in so much as no one really wants to attack them because they've got deep pockets and they can get away with it. Whereas if you're an individual physician doing this type of work, we all know what happens. All of our colleagues have been attacked at one time or another. So one of the problems I see is that there has been this ongoing issue, basically a fight between them and us. And it just continues to manifest into this separation of the two different groups. I think going forward, it's very, very important that we bring the parties together. From the first and foremost, from the government side, the Medicare payer system, the insurance companies, and the medical boards. There has to be an incentive. A lot of physicians, I think, deep down would like to provide their clients with quality medical care, but they're very frightened. And I can assure you, if you don't know anyone who's been in the field of preventive medicine, orthomolecular, functional medicine, who's been under attack, it can be a really daunting experience. And of course, most physicians just don't want to go through that. I mean, certainly, I'm hearing from people who I know who are still working in the system, they're afraid to even talk about natural means of dealing with COVID. They barely will mention vitamin D. So I think it's absolutely essential right now that we find a way to bring these groups together so that they see that there actually is a reason for them to participate in growing quality medicine and educating their physicians. That's another side of it too, I think, that causes a lot of problems, because a lot of doctors are very frightened about this because they realize that they know absolutely nothing about these things. They haven't studied, biochemistry much. And in fact, most times, it's funny, I'll be in a meeting with physicians and talking about whether it be, methylation chemistry. They get very frightened when you start bringing things to them that, that they're not really familiar with. And there hasn't been an incentive for physicians to be able to step forward and to be brave. It takes a very brave physician to start doing vitamin testing, let alone prescribing nutrient therapy, even megavitamin therapy under certain conditions. So I think it's absolutely essential as we go forward. We've got to find a way to be able to bring these major power forces together. The medical boards have had great power and have really held back a lot of great science because people are too afraid. At the Orthomolecular Medical Society and the Society for Orthomolecular Health Medicine, it was always so frustrating. Just getting, we had, everyone from Julian Whitaker to my father to Linus Pauling, and just getting CME accreditation was an absolute nightmare. And every moment there was a stumbling block and people were getting in the way. There's got to be a way to be able to get these people to recognize that this is the future, that they're going to have a piece of the pie, and that there's enough for all of us to share. Certainly, the general public out there, I don't think they understand the threat that these physicians are under. They don't understand that every doctor that's doing something outside conventional therapy is putting his life on the line. And I think we've got to bring these core groups together to be able to make a difference. And I think it's going to take a political piece and working with all these different groups so that we can actually get somewhere and not be constantly doing battle and feeling, we're chasing windmills.
Well, I think you're right, Gregory, and I think that one of the things you mentioned was the discrediting. You do realize that the Cleveland Clinic was in total, put on Quack Watch. So it's not just the individuals. I mean, they're so bold that they not only put Linus Pauling on Quack Watch, they put the whole Cleveland Clinic on Quack Watch. And an encouraging note, there's a lot of work going on with medical cost sharing organizations. And those organizations are growing every day as an alternative to health insurance, and they do have the opportunity to cover the wellness and the stuff that we're covering. And there's a new insurance company that's being developed right now that's going to cover it almost exclusively. I can't tell you anything more about it except that I'm working on it with somebody. And FullScript, you may or may not know, has 25,000 doctors that they work with and 1 million people that buy supplements from them. So FullScript has a benchmark, a footprint. They're there, and there are doctors that are doing this. I know there are. And so we just have to make sure that we take those things and we parlay them into the opportunities that you described. This process will allow us to do this very efficiently and very precisely.
Well, I'm all for it.
Thank you. Thank you for your support.
Hey, NHF President Scott Tips.
Hey there, everyone. Thanks. I just want to.
Miracle in our life.
Oh, I hear someone's voice. If you can mute yourself, please. I'm here with Bill Sardi, and he is our NHF policy advisor and a member of the board of the Foundation for Health Research, and also in his own right, of course, health researcher and writer. So he's been overhearing some of this conversation, and he'd like to make some comments, and so I'm going to turn it over to him.
Yes, thank you, all of you. I'm sorry I don't know all of you. Greg Kuhn, I do, and thank you for your wonderful comments, Greg. My position is we're winning. We just don't know it. The biological action of every prescription drug can be duplicated with what's at the health food store, frankly. We don't realize that Medicare is broke, and so is Social Security, which is why all of this turmoil and tyranny right now. Medicare was counting on 360,000 Medicare recipients dying in the COVID so that they could balance their budget. I wrote an article about this. Attacking and killing off the older people is the objective. They're costing too much. The problem is, despite all the failings of modern medicine, a good portion of the people are living beyond 80 years old, and we can't afford them anymore. And that's what our society cannot live a social contract with its people anymore. And so it's like they want an extra time. So the life insurance companies, which is, I know the Hospital Corporation of America is the greatest threat to their profit making.
Alex, going to move on.
So we're back on. Yeah, no, I'm trying to finish a comment here, if I may. I believe we should create an opposing system. The American way is to create competition. We need to allow people to opt out and go somewhere else. And unfortunately, money is all taken up in the Medicare system, and that trust fund is broke. You have to realize we're winning because they didn't have a vaccine and everybody ran to zinc pills. And I created that. I got a letter on the president's desk, and the next week he was taking zinc and hydroxychloroquine. So it happens. And you couldn't find a zinc pill that was available anywhere for quite some time. So the Americans got baptized into finding natural remedies and vitamin D more than ever in this current situation, despite anyone's efforts to make it change, or else that's all that was available and people were frightened. And that we use the fear on our side now. They had nothing, we had something, and a lot of people have adopted natural remedies in this time. We need to take advantage of it. I want to say that modern medicine right now is treating numbers, pre-disease states, pre-diabetes, pre-heart care. Your cholesterol's too high, meaningless. The risk of a non-mortal heart attack is lowered by 1 in 240 statin drug users. So it's a useless drug. We're treating numbers, really not disease. We need to study health and why people stayed healthy instead of why they got the disease. These are obvious things. When you're talking about fear, it's real. White coat hypertension is an example. Take the blood pressure in the doctor's office and you can't rely on it. The people are afraid. It raises your stress hormone levels. We're treating numbers, but you could go into a study, a well-controlled study, but you're treating the wrong, inappropriate thing. In other words, if your blood pressure is up, is that because there's too much fluid in the system and therefore you need to give a diuretic? No, not really. It's because the blood vessels aren't dilating most of the time, and you need some nitric oxide to dilate the blood vessels. Now, it's possible there's too much fluid in the system due to heart failure. It's also possible because the kidneys aren't working, and a new discovery in the last year is use some zinc and you'll make those kidneys work again, and your blood pressure goes down without all those ACE inhibitor drugs that deplete zinc, frankly. So you need to treat the right thing, and you may have a double-blind study. You can take people with high blood pressure and treat them with a beta blocker, and that slows the heart rate, and now the pressure comes down. However, everything above the neck, above the heart, now is suffering for oxygen because you're having 60 less heartbeats a minute. You can do this with fish oil, about 12 less heartbeats a minute, bring the pressure down, and obviously not have the side effects there. So you have to study the right thing, and what they're doing is treating things with diuretics when there isn't too much fluid in the system. You have to find out what type of hypertension you have. So these are my comments. I believe, in summary, I would suggest that an alternative system of health be brought to compete with the other side, and that's my suggestion at this moment.
Well, that's a wonderful suggestion, and I think we could all kind of agree with it. I have 100 solutions that I would like to add, but I'm not going to add any of them because this process will sort that out. So if the weight of evidence and the weight of decisions by the people involved in the process come to that conclusion, then that's the one that will hit the top of the charts. And so this isn't about any one person, mine or anybody else's. It's about what the group collectively finds through their research is the best way to approach it. That may be something that comes out of what you're saying. It may not be. I had a top CEO in the government, Geological Survey of Canada. We were doing a priority setting process, and he had 4 dots, and there were 40 things to put his dots down on the 4 that he liked. He approached the platform to put his dots on, and I said, "Sir, you can't go right now. You have to wait and go last." And he said, "Why? I'm the deputy minister." And I said, "Well, because how many people would have their nose right up your behind and put their dots right where you are?" As a result of that, the other people, the other scientists and decision makers voted first. He voted last. 2 of his priorities got chosen and 2 of them did not. And he said at the end, "This was the best decision-making process we ever had. We've been trying for 10 years to get this situation resolved. Your process did it." This process works every time.
Excellent. Well, I know Beatrice has been very patient. Are you there, Beatrice? Can you unmute, or I can do that for you?
I have him unmuted. Maybe I'm off.
Yeah, we don't see your video, but we can hear you okay.
Okay, oh yeah, of course. Sorry. That's better.
Hello.
Hello. Maybe I'm not exactly on what you are discussing, because when I work with clients and I do holistic cancer therapy, I work with individuals and not with institutions. And I know the National Health Federation has a broader goal, which I support. But one thing that always is missing when people are talking, doctors are talking, people are talking about supplements, is how to connect with the person who is asking for help and really know what the traumas are, what the developmental state of the person is, whether he or she has been stuck as a 5-year-old girl just asking for a good mother or father to take care of her instead of taking care of herself or himself. And when people start developing themselves from the inside out, but that's because I am a psychotherapist for over 30 years, and it has always been my work with people. So I don't talk about supplements. I talk about their inner conflicts and about their inner things that are going on, whatever it is, whether it's a conflict with a spouse or an inner conflict, about why they do not take care of themselves. And if people start respecting themselves instead of staying a child, depending on a solution from the outside, an insurance company, the government, whatever it is, you'll never get there. You'll have to develop your inner independence. And when I had to do a part of my study over again here in Canada, and I studied the new DSM-5 for psychology and for doctors, it was so clear that in all the comments, that we had a big book about the comments on DSM-5, that in the comments was so clear that the in the higher task force of putting all those symptoms in the DSM-5, which are not for psychology, not for doctors, real understanding why a person is ill, what the root cause is. They don't. It's just a list. I'm sorry, I have to look for words. I'm Dutch, so I'm sorry. A list of symptoms, and it's not a real illness. And it was very well documented in all kind of critical DSM-5 books, that in the highest task forces where they make that, what where they make the DSM-5 is that they will never make public what the decisions are, and all the members of the highest task force for the DSM-5 are paid by the pharmaceutical industry. So what is in those books that is guiding doctors or guiding psychologists is just bullshit. They never really are interested in who this person is that they have in front of them, what this person has to do to get on their own feet instead of expecting healing from others, whether it is a pill or a supplement or whatever. Well, that's what I want to say. Maybe I'm not so clear. And processing emotions is hardly ever done here in Canada. People are empty. People are just disconnected from their emotions. But as soon as you start processing emotions, whether it's fear or sadness or anger, and really start feeling what they are and what they are about, then people start healing by themselves. So.
Yeah, I think those are excellent comments. And I think that you were right when you said, you know, you're dealing with individuals and it's a lot more complex and difficult. I think when you're dealing with countries and organizations, it's important to note that only about a third of any group, whether they're individuals or organizations, is really willing to make a change and ready to make a change.
Yes.
And a third of them are like what we call the fence sitters. They're waiting to see how things move.
Yes.
And then the other third are foot draggers, and they'll only change when it's life threatening and or financially threatening to the nth degree. So we have to get those people who are on the fence. In other words, the first third, they will come with us because they're already with us. We just have to give them some reasonable ideas and expectations. We have to convince the next third to come with us on this journey. And in the process of doing that, we will not resolve every problem. This is not a perfect system. And so the things that you're talking about will probably, I'm not saying it will be the case, will probably come out as one of the key needs to be addressed. But it may not be the thing that pulls the trigger to get us moving in the direction. And so we're going to document all the ideas so that we have an ongoing strategy. This is not just a 3-month strategy. It's a 3, a 5, a 10-year strategy, but we have to get action within the next 2 to 3 years, enough so that we're able to move this thing a little further and a little faster than we have in the past. But we can never leave an idea like that behind because it's too valuable, and I agree with it. So I just want you to know that the process will document those things and put them in, I hope, the right perspective and the right priority, and I hope they will never get lost and always be paid attention to as we go forward to improve the healthcare system.
Thank you.
Thank you.
Hey, Charlie.
Sure. Thank you, Alex. And Dr. Benz, do we want to suggest next steps and maybe invite Scott, Jack, and you to close out?
Yes, I think for my part, I would see us moving forward to step 3, which is the root cause analysis. There may be some wordsmithing that can be done in the goal and the problem statement, but I think if they are essentially correct, we can probably move forward with them as they are and just say, let's invite people. And I think that Jack had a good idea earlier. Let's get this video done. Let's get it really polished and presented so that we can take it out there to a larger group of people, not only within the Federation, but within other organizations that become the target of our program. And then get them to the point where we say, we would like to have you send us 3, 4, 5, whatever number the group agrees on, root cause analyses of the problems that we've stated and the goal that we've expressed, and see if people can start to assemble those, send them to Alex and Charlie and myself maybe, and then compile those lists so that we can have another webinar that says, here's what the root cause analysis revealed, and share those as kind of a beginning of the next step, which is the problem solving process. That would be my hope for the first immediate step.
Sounds good. So you said each person providing up to 3 root cause analysis. Did we already determine that, or?
I'm just saying that because if every person puts in 10 or 15 or 20,
Yeah.
then we're going to be inundated. We're going to have like 2,000, and then somebody's going to have to do the sorting out. And so we don't have immediate funding for this. So I'm just saying if they could do 3 to 5, that might be a manageable number, so that we could see, this is the problem. What is the root cause of that problem? And when we send that, I would like to send 2 or 3 examples of what root cause looks like, because there's going to be about 3 or 4 levels in my examples where they say, this is the problem. And then I'm going to say, no, how about this? How about this? How about that? So we're going to dig down and show them what the root cause really looks like, so that they're getting accurate root causes to begin with. And then they'll get detailed instructions of how to do that.
Dr. Benz, would you like folks to have your email that I can type in chat? So submit
Yes.
those problems?
Yes, I think for now, we don't have hundreds and thousands. So I think these are like the key interested decision makers, and I'd like to hear from them. And so, yes, that would be most welcome.
If you want to tell me your email, I'll type it.
Okay, here it is. Oops. It's bensck@gmail.com.
nck@gmail.com. So email your 3 to 5 problems with the healthcare system, and we'll itemize and get the process started, and you'll hear from us.
Dr. Benz,
Yes.
moving forward, the roadmap has to be as clear as a bell to the people that are here with us today. And I wish I could say I've actually been in a program like this before, but I haven't. In spite of all the things we've accomplished, I think there's many people that we've accomplished some pretty spectacular things. But under the circumstances, this global problem we're dealing with, and it has to begin on the platform here in the United States. We have to come up with the solutions for the rest of the world. That's what we do. So you have to guide us now with regards to the very next, I think, when should we have another meeting? This video has to get out. I believe that everybody here should think about people that they know who need to be alerted to what we're being guided to by Dr. Benz. There's got to be a way we can communicate with all of the people here. It's a perfect group, in my opinion. How many people are here, Alex? Can you tell right now?
We had like a little bit over 30 at one point. Now we're a little bit over 20. I will say, though, I just want to let everybody know about breakout rooms. So I'm not sure if this is where we're going, but Zoom makes it easy for like a large group to be broken down into specific rooms, So if that's something that can be useful for us, because it seems like the problem has already been named. We're not open to anybody else characterizing the problem or anyone else characterizing the goal. Is that correct, Dr. Benz?
I think it's general enough that everything anybody would ever want to consider could be included in there. So I think you're right, Alex. I will send, Charlie and you and I are going to figure out how to send the link so that they have the detailed instructions of this problem solving process. And then we'll say, we would like you to concentrate on step 3. And they can go to step 3 and see exactly what the guidelines are. And then we can sort of override that and say, we'd like you to concentrate using these guidelines on the 3 or 4 things that you think are really the root cause of this problem. So
do we grow a database? Should we collect everybody's name, email address, phone number with this initial crew?
I think so. And I'm
hoping so.
Yeah.
Because post-production, we had pre-production meetings, but we need to get the post-production into place now because we're actually a team right now. We have become a team, this crew. And at the end of the day, if we can now share, how do we do that? I don't know how to do that.
Okay. Really, Jack and Charles, what we need to do is NHF already has a list. We need to maintain control within the NHF of that. So we have a promise to members that we don't share their data with anyone, and I will keep it that way. So let's kind of stick to the process.
Is there a way, Scott, where people that are in this room decide if they want to share that information so they can, how do they get the video?
Well, they can of course decide, but really what we need to do is have it sent to Alex and/or Charles Froman, and on behalf of NHF, they'll filter it out as needed. That's really what we need to do. I'm just a little hesitant to allow this process to get kind of out of control.
I think that's fine. When we start to send the video out to other organizations outside of the Federation, I think we can direct their comments back to the group too. I mean, that's all fine that it says a central point of collection and sorting out.
Thank you, Charles. Yeah, well, let me just say, in the same way that you wanted to maintain, the invitation being sent out through you to your contact people, which I respect, by the way, and I agreed with. We have the same concerns with NHF. So we need to be a little careful here. And otherwise, what you have is you could have people coming and just mining these meetings and stuff for contacts, and then they just do their own thing with them. So, and that's not always what people online want to do. Of course, they can voluntarily give you their contact information. I see here that's what has happened with your email address there, Charles Froman. While I'm talking, while I have the floor, unfortunately, I came on late because I had a little trouble finding the link for this meeting. And so I missed Jack's discussion at the beginning, which I understand had happened. So I don't know about this video thing that's been mentioned, but I can always talk with Jack later. I don't mean to hold everyone up because of my coming on late, but I'll talk with Jack about that later, I suppose.
Scott, the whole idea here, based on meetings with Dr. Benz, and what I've learned from other folks, the video is literally the key to broadening our audience into the group sessions that'll come, as Alex has brought to our attention, right? And the keys to getting to the solutions Dr. Benz needs from the Q&A. So this video really does open the door. I can think right now of about 7 people that need to get this video from me because they're perfect for it.
And this video being this meeting?
This video we're looking at right here, Dr. Benz's initial presentation, because
I see
he was very efficient in delivering it. But
yes,
the last 4 sides really, I mean, it really is, when you look at this a second time, it's like breathtaking.
Yeah, I took Jonathan Wright an hour at the IAOMT event to say what Charles Benz said in about 15 minutes. So
you're very kind, Scott.
So well done, Charles.
Well, we will. Let's say that we'll have a post-production meeting, and one of our goals will be to kind of create a template for the invites of the video, and that we make sure that everything gets funneled through the Federation in terms of feedback from the process, so that we don't have any compromising of the Federation's list. And if we need to have some help sorting things out, we're going to try to keep it succinct with the 3 to 5 goal, and then hopefully we'll be able to get through it quickly. Alex and Charles Froman will be able to get through it quickly and say, okay, these are the 50 or 100 that seem to be dominating the feedback we got. But that feedback will now just include the Federation, but also these groups that Jack and I and others are going to suggest be included in future discussions and in these teams that Alex mentioned.
And also, thank you, Charles. Also, I would just add, Ronald Schmidt had a nice chat comment about a disruptive strategy, and we ought to definitely consider that. I think probably what may happen is that there will be a significant economic collapse or event like that, or another catastrophe in the near future that will accelerate the process anyway, regardless of what approach we take. But we should at least consider Ronald Schmidt's suggestion as well.
Yep.
Schmidt's projection and really was an evolution out of Dr. Benz and another person here I can't think of. But Schmidt's response to that is a primary reality that we have to focus on nurturing. I would like to have Scott Tips guide me now. This crew, these people right here, I am prepared to make a donation to help continue this this forum. I'd like to call it Dr. Ben's Forum. Okay. The Organizational Development Forum, the National Health Federation, the Future of Medicine Foundation. Now, Scott, can you guide us? Because I would like everybody to receive. How do we deliver the support economically that such an undertaking will
Require.
be fueled, will be fueled? Everybody's quiet.
I'm sorry, Jack, I just didn't understand the last question.
Okay, forgive me. I would like to, I know that this is going to take a little bit of economic support, and I want to go out and work at that. The people here, I want to establish with FHR, the use of their 501c, how to take donations. How can we take donations to continue this program and its cause and effects in markets, the time of certain people associated with what we're doing with NHF. If we have no doorway to receiving those donations, I don't think we'll succeed here. I think people are going to rise to the occasion. And I feel like it's important that I do, you know. So how or what would you recommend? Or is it, let's lay the platform down. Let's discuss this just a moment before we leave on receiving donations that enhance this particular organizational development program. Quite a necessary one. If we focus on Ronald Schmidt's last, we really have a powerful opportunity here. It's unbelievable. I see it clearly.
Well, to answer your question, Jack, it's really easy to make a donation. I appreciate your bringing it up, but I don't mean to also hit up every attendee here for that, but maybe they know people or whomever who could contribute. But you just go to the NHF website, and it's been done in a good way to make donations. It's very easy. You can do that at the NHF, thenhf.com. /donation, I think / again, page, or if you prefer to make it to the Foundation for Health Research, FHR, then you go to Foundation for Health Research, all spelled out, all one word, .org, O-R-G, and it can be done there. And then with the designation, there's a comment section. You can designate what it's for, and so it could be for the purpose you were mentioning, Jack, for this Charles Benz. Thank you, Alex. Very well done. So you can see on the screen there the appropriate page, and then it just has a red button. Click here to donate.
Fantastic.
Or you can send it.
Dr. Tips. Scott Tips, this has to come from you, okay? This program is so valuable, but it's going to need fuel. And it's the main focus of my initiatives on behalf of NHF and FHR. But your leadership, acknowledging the fundraising abilities that we have and the tools that we have for making it easy, everybody can share this literally with their friends and family. I'm a funeral director's son. What I've experienced in Man's Inhumanity to Man in the last 2 years, and what it's done to our embalming rooms and embalming rooms of friends and family around in the business around the world. Our funeral homes and our community reaches beyond our borders. We have to sacrifice whatever it takes to take Dr. Benz's initiative, the NHFOG, Organizational Development Initiative. And we're going to find out that Ronald Schmidt hit a home run here, because when we get this questions asked and we do it in formal terms from our meetings, after we build his base a little bit with regards to using our video to entice people to become involved because they can express themselves here and we can get results here. Funding is a key. So thank you very much, Scott.
Thank you, Jack. Thank you for that.
Okay.
Well, it's 1:44.
Yeah.
When you're having
Right.
fun, Alex, it never stops.
Yep.
Yeah.
So for everybody's knowledge, right now this video is available on the NHF Facebook page under our video tab. And then we also have our YouTube channel. Our September Zoom is up there right now. And then as soon as this finishes downloading and then I have time to edit it, I'm going to upload it to the NHF YouTube channel. And then I will save a file just in case anything, happens to that YouTube channel or we upload it to another platform if need be. So thank you again, everybody, for attending today. Really appreciate you all.
Thanks very much, all.
Thank you.
Thank you.
Great to see everybody.
Yes.
When's our next meeting?
A great question. Let's see what happens with the analysis. And I don't want to keep going on, but I'll be in touch with you, Dr. Benz, because maybe you could use like a Google form to make it easier. So then when people send you the analysis, it populates a spreadsheet for you instead of you manually doing that.
Okay. Appreciate it, Alex. So we'll absolutely do that.
All right. Sounds good. All right. Well, we'll be in touch, Jack, about the next meeting date, the exact one.
Post meeting. Post-production meeting.
All right. Bye, everybody.
Thank you.
Bye, everyone. Aloha.
Bye.
Aloha.